Hi, it's Rachael here from Yoga for Pain Care Australia, and we're putting together this series of videos to help you learn more about Yoga for Pain Practitioner Training and work out if the 2020 initiative is something you would like to be part of. So there's one video that covers the content of the course and what you can expect in terms of time commitment, the topics we cover, and the support that we provide in mentoring and assignments. And in this session, I want to give you a little bit of history of Yoga for Pain Care Australia. And the point that I'm going to start at is the end of my TEDx talk, because I know many of you will have watched that, and that's got a background to my personal experience with persistent pain and the original reason why we started Yoga for Pain Practitioner Training in 2014. And that reason, to give you a brief recap or let you know if you haven't watched that video, is because we realised that there was a big gap in pain care in Australia, and the gap was the point where people leave medical care and health care, whether that is their tertiary pain clinic or their physiotherapist. It was really hard for health professionals to have somewhere to send their clients where they could continue with the self-management. And also, I guess from our perspective, is not just somewhere where they could manage their pain, but a place where that they could feel welcome and able to participate, because for many people with pain, doing ordinary things is very, very difficult. So at this point, we had been running a 2.5-day Yoga for Pain practitioner training, and this will give you a little bit of information about why the program is now much longer. And the reason is that 2.5-day course, the physios, OTs, the yoga teachers, the nurses, they said, great, this has really changed how I am working with my pain patients or my students with persistent pain. And in fact, for many, including the yoga teachers, it was changing how they worked with their ordinary clients as well. But what wasn't happening so much were new services. And so we realised that if we were going to fulfil that mission that we had as an organisation to fill that gap, make sure people with pain had somewhere to go in the community, we were going to have to work a lot harder. And so as a result of that TEDx talk and a few other things, we partnered with a not-for-profit health agency from Western Australia. And if you've seen the blogs, you may know that there's some write-ups at various stages of that program, Yoga for Pain Down South, where we selected providers from small towns in regional Western Australia, and we were actually targeting for this program chronic disease hotspots. So these are towns where there's high health needs and low services, and often in those areas there's other economic challenges, perhaps low incomes or unemployment. And this is not uncommon with pain, because as you probably know, persistent pain can really affect somebody's livelihood, their work, their relationships. So we partnered with GP Down South to design a Yoga for Pain practitioner training that would really target the needs of that community. Because the kind of economic situation that people are in, the kind of types of pain that people are experiencing, the psychological distress, all affects the kind of providers that we need to have in that town. And we are now 18 months after that training, and we selected providers very, very carefully for that training. There was an application process, and we were looking for people who were interested in persistent pain and in helping people with persistent pain. We were looking for people who had an understanding and experience in contributing to their community, and also who were very open learners. And the reason that this was important is because pain is complex. It's not just a physical or a physiological problem. It's very much affected by your social situation. Your pain affects your social situation. And so working with pain is complex. What we know individually about pain, what we know as a scientific community or as a social community is also changing. So to do good work, we have to be really constantly inquiring into what are we doing that's working and what are we doing that's kind of not. So that was how we chose the providers, and I'm really pleased that those providers now are running different services across Southwest WA. we also got some results that showed that referrals into the program increased over the 12-month trial period by 83%, and the services delivered increased by about 150%. So what that means is that community nurses, GPs, other health professionals were referring their patients into into Yoga for Pain programs, and also that the people were taking it up, because we know that there's some kind of programs available to help people with challenges, but they don't always go. So this was another piece of sort of more anecdotal feedback that we got from GP down south, was that what they call do not attends was very low. People were actually attending. They said they wanted to go. So this means a lot, because if we want to make a difference in people's lives, they've kind of got to be there. And this is great now, because we've got these providers in small towns, and that's really the idea that was set out in the TEDx talk. We proposed that we could use these skills we'd been doing. We'd been offering skills of yogic education, of program design, of inquiry-based learning, to equip communities with providers who could work in a really tailored way, to work kind of almost in a specialist way, but also affordably and accessibly. So that was Yoga for Pain down south, and that's great, but that's one community. It's southwest WA, it's chronic disease hotspot. So the question now is, how do we do that in more areas? And whether that is regional New South Wales, in an area that has been devastated by bushfire, or inner city Melbourne and working with people with mental health challenges and persistent pain. And that's where the 2020 program comes in, and this is the reason that we offer the initiative at the length that we do, because we really want you to have the time and the support to get something up and running that you're happy with and that has the outcomes for your clients that you would hope. And the outcomes that we're particularly looking for is that people have got pathways from healthcare into transitionary services. These are probably going to be yoga-based, based on who's coming into the training. And that those people with persistent pain who are going through are able to go on and go forward with their lives and really look after their physical, social and psychological well-being and live a really full life. So what we would love for you to be able to do at the end of the program is have a course that you can offer your clients, whether that's individually or group-based, and have a really a good understanding of the networks and the pathways that will allow people with pain to take those steps. The last thing I'll mention in this video is to explain what we mean, or what I mean, when I say it's not yoga teacher training. So, what we're not trying to do here is churn out more yoga teachers, because there's lots of yoga teachers and there are lots of ways that yoga can help people with persistent pain. But what we really need are people in the community who can look at, with the group that I'm working with, and the outcomes that they want for their lives and our community wants for their lives. What do I need to offer in the limited time that I have so that they can get there? And that role is going to be played by many, many people, by yoga teachers, by physiotherapists, by OTs, by GPs, by community nurses, by social service workers. And so the way that you will apply the content in Yoga for Pain Practitioner Training is really, really varied. Yoga is not just about postures and movement. There's a really rich philosophy that we start to go into the course that will help you as a provider and also your students or your patients with persistent pain. So tune into the other videos for more about the detailed content of what you can expect. Thank you.